Good morning, everyone. My name is Edwin Bernard. I'm the coordinator of the HIV Justice Network. We are a closely knit, but a close but loosely knit international group of people who are working against overly broad HIV criminalisation. And we also work very closely with GNP Plus on the criminalisation scan. Yesterday we held a one-day pre-conference called Beyond Blame on this issue, and it was a very exciting conference. Judges and politicians and activists and people with HIV all joined, including criminalisation survivors, were all there together. Something very exciting happened that morning. There has been a campaign here locally in Victoria. Victoria has the only HIV-specific criminal law in Australia called 19A. And the Minister for Health announced, quite surprisingly, that the government were going to at least review the law. We'd like a complete repeal, and we will. The activists here and globally, everyone should support a complete repeal. But it was an exciting moment. I'm going to just give you a global overview of, first of all, what the problems are, and then tell you a few exciting developments. So this is a very busy map, but it basically tells you where we know HIV non-disclosure, potential or perceived exposure, and non-intentional transmission is a crime. And you can see that actually around 70 countries have reported prosecutions around the world since the AIDS epidemic began. Around 50 countries actually have HIV-specific laws, although we're only aware that about half of those countries have used them. That doesn't mean that the others haven't, but even just having them on the statute books is problematic and stigmatizing. In terms of the law enforcement hotspots, so these are the places where per capita of people living with HIV, there are an unusually high number of prosecutions. You can see that North America actually, unfortunately, sort of leads the way, and those particular states in the US are particularly problematic, as well as Canada. You can also see that the Scandinavian countries in Europe, as well as some countries in Central Europe, particularly Austria and Switzerland, are problematic. And you can also see the little dot off the coast of North America, Bermuda, another place that's really problematic. 5 prosecutions, and there's only 200 people living with HIV, as far as we know. And then here in Australia, you can see, and New Zealand, another area where there have been an unusual amount of prosecutions compared to the number of people living with HIV. Now this is a preview of a poster that we'll be presenting tomorrow, showing where, in fact, first of all, the purple spots, which you probably can't see very well, where new HIV-related criminal laws have been enacted. This is despite UNAIDS, the Global Commission on HIV and the Law, and all international agencies saying there should not be any HIV-specific criminal statutes at all. You can see that Botswana, the Dominican Republic, Greece, and Uganda have all enacted laws that are punitive and stigmatizing and also unscientific. They really do not help the cause in any way, but often they're passed for political expediency reasons. You can also see the blue. Unfortunately, this is in the last 3 years where we're aware of prosecutions. The list is extremely long. I'm not going to read it out, but you can see that they're happening, or we're aware that they're happening pretty much all over the world. And even where the areas are grayed out, that doesn't mean they're not happening. It just means we're not aware of them. But you can also see tiny dots of light green where HIV-related laws have been either limited, removed, or revised. And we can actually now add, hopefully add Victoria to that list. Denmark, in particular, remarkably, they were the only country in Western Europe that had an HIV-specific criminal law. and it was suspended in 2011 because of advances in science and medicine. The law basically just wasn't relevant anymore, and there has been no law since then. The sky hasn't fallen, and it shows that it is possible for there to be no laws, and for justice to be served, and for people living with HIV to live happy, healthy lives. Iowa also remarkable. I know I don't have very much time, but there have been a remarkable number of really encouraging policy developments. I've mentioned Denmark. Switzerland also revised their law. They had a tremendously draconian law that will change in 2016. Sweden, as well as Canada, both countries have advocates have worked with health professionals and experts to produce their own versions of the Swiss statement. So there's a Swedish statement, there's a Canadian statement, specifically to make sure that the science around, particularly around the risk of HIV transmission, is understood by the courts. And very excitingly, in the United States, Iowa became the first US state to modernize a very draconian law that happened in May. A few weeks later, the Supreme Court in Iowa also recognized the importance of looking at the science of risk. And just last week, the US Department of Justice has issued guidance to eliminate or reform HIV criminalization laws. And the US has 32 states with these laws, that they should be based on science and not stigma. And in fact, Lambda Legal, a major LGBT NGO in the US, has actually called for a halt to all prosecutions until these are implemented. There's still a long way to go, but it's fantastic to actually say that there are now encouraging policy developments around HIV criminalization. There is a real global movement to reform or ideally remove laws and policies that punish people living with HIV, and hopefully in another couple of years in Durban we'll be able to report on a lot more fantastic things. Unfortunately, there are still problems. Uganda, Dora from Uganet was supposed to be here too to talk about the problems in Uganda, where, as well as the anti-homosexuality law, they also passed a really draconian HIV criminal law. There was also a horrendous prosecution of a nurse earlier this year who accidentally pricked herself whilst trying to deliver an injection to a baby, and it was characterized by the media as a deliberate attempt to infect this baby, and she was hounded by the press and prosecuted for, originally it was intentional transmission. I think in the end it was sort of negligence, but she got I think 2.5 years or 3 years in prison for this. So the issue of HIV criminalization isn't just about consensual sex, although that's where many of the prosecutions are happening. It's also for sex workers, for healthcare workers, and so we need to continue to be vigilant, even where there is great policy reform. In some countries there are problems in others. If you're interested in knowing what's going on around the world, I recommend the GMP Plus HIV Justice Network a report advancing HIV justice. And if you haven't read and signed and distributed it yet, please go to HIV Justice Net /Oslo, read the Oslo Declaration on HIV criminalization, and make sure that people understand it's a very simple 2-page document, a roadmap that fits very well with the Global Advocacy Agenda on what's wrong with criminalization and what people can do to change it. Thank you very much.
Thank you, Edwin, for not only giving us a quick scan of what's happening with criminalization globally, but also for pointing us in the direction of some of the areas where progress is currently being made.